Hi, my name is Catherine Kirkland, and the current date is April 28th of 2021, and I'm going to be doing my presentation on cystic fibrosis. So there's my card. Cystic fibrosis is a genetic condition that typically causes respiratory symptoms, but can also lead to symptoms in other areas of the body, like the reproductive system and the gastrointestinal system, or digestive system. The typical manifestation is the thickening of mucus in the lungs. This is caused by a mutation of the cystic fibrosis transmembrane conductance regulator protein gene, or the CFTR gene. This protein basically regulates the movement of salt in and out of the cell. The severity of disease depends on the type of mutation that's present. There are some mutations that are much worse than others. There are some people who have multiple mutations, so those would obviously be worse. So it really just depends on the person and what exactly is going on. This disease falls within the bronchiectasis syndrome because cystic fibrosis leads to a widening of the airways and scarring of the airways, which makes it really difficult for people with CF to clear mucus from their system, which can eventually lead to infection. So overall, the cells that are most affected are the goblet cells, which produce mucus in the body. It causes this mucus that's produced to be very thick, and it can clog up tubes, ducts, and pretty much anything in the body. So it makes it difficult to have everything in the body functioning as normal. So it causes various symptoms depending on what is what's affected. So for respiratory symptoms, the signs and symptoms would be like cough, recurrent lung infections, chronic cough. So a cough that doesn't go away over time. It would just continue or possibly get worse. It could also cause pulmonary hypertension and wheezing, which would basically, you'd be able to tell if somebody had cystic fibrosis just by listening to them once these symptoms start to develop. Then next, there would be symptoms of the reproductive tract. So it can cause infertility in men, which is very common due to what's called CBAVD, which is a congenital bilateral absence of the vas deferens. So basically, men with cystic fibrosis produce sperm, but it doesn't actually make its way into the semen that is eventually ejaculated because there is either an abnormality or a complete absence of the vas deferens. So it can also cause, in women, it can cause thickened cervical mucus, which can lead to decreased fertility or just overall a harder time getting pregnant. And it can also cause a delay in puberty and development in adolescence. So, it's not uncommon for people with cystic fibrosis to not hit puberty until they're much older than the average person. So then moving on to GI symptoms, it can cause fat to be present in the stools and can cause abdominal pain and can also cause liver problems. So basically some just general signs and symptoms would be the inability to gain weight, continued weight loss, and delayed overall developmental milestones like talking, walking, crawling, things like that when you're a baby that basically kind of set the basis for everything that you're going to be learning the rest of your life. Usually newborns are screened for symptoms and signs of cystic fibrosis. They may not show up yet, so the most common thing in all 50 states is a heel prick, where they'll prick the baby's heel at 1 or 2 days old, and then they will take the blood and rub it on what's called a Guthrie card, and it's then sent to a lab, and the lab will then check for pancreatic immunoreactive trypsinogen levels, or IRT levels, If these levels are high, that's an indicator that this person does have cystic fibrosis. So then they will be sent for a secondary test, which is a sweat test. So basically the sweat is checked for salt levels, and if the salt levels in sweat are high, that is typically an indicator that this person has cystic fibrosis. And in some cases, these patients that fit both of those criteria are sent for testing for the CFTR gene just to see if there are any mutations. And once 2 or more mutations are identified, that person is definitively diagnosed with cystic fibrosis. As for a differential diagnosis, there is something called CFTR-related metabolic syndrome, which is CRMS. And this is basically when an infant has the high IRT levels but normal sweat test results, and has less than 2 mutations of the CFTR gene. Basically, this diagnosis can't be determined right away. It's one of those things that you have to go back in and keep getting retested for over time. And if your sweat levels continue to remain normal, but your IRT levels remain elevated, then you're eventually diagnosed with CRMS. So it's very similar to cystic fibrosis, but does not have the same implications. There are a lot of complications that can be associated with cystic fibrosis just because of the variety of body systems that are affected. It can cause chronic respiratory infections, so basically just recurrent infections that are really difficult to get rid of. It can cause growths in your nose, nasal polyps. It can cause hemoptysis. Hope I said that right. That's coughing up blood. Can cause leaking of air into your chest cavity, and then a lung collapse, which is a pneumothorax. It can eventually lead to respiratory failure. Nutritional deficiency, because there are no digestive enzymes being put forth by the pancreas, or minimal levels of digestive enzymes being put forth. So these nutrients can't be absorbed properly. It can cause diabetes because the pancreas produces insulin, and if the pancreas isn't producing insulin, then you're going to be diabetic. These people are more susceptible to bowel obstructions and can also have liver disease due to a blocked bile duct, because cystic fibrosis causes blocking of the ducts in the body. And again, it can cause infertility in men, osteoporosis, electrolyte imbalance, and dehydration because of the high salt content in sweat. And of course, since it's a chronic illness, it can lead to mental health problems, which is a big concern because this disease is not curable. Currently, the average lifespan is about 44 years old, and death due to cystic fibrosis is usually due to a secondary lung complication. Thank you so much.